final presentation today is Ricki Hersburgh and Luke van der Beeke. Ricki is the board director at Plastic Oceans Australasia. Ricki has devoted her career to driving systemic change in various sectors. Ricki has a diverse professional background from delivering environmental education program and held senior positions in WWF, Greening Australia, Hinter International Hotel Groups. Luke is a social entrepreneur who holds many roles, co-founder and managing director of the Behaviour Change Cooperative, chair of the BCC Impact, adjunct professor at Curtin and Griffith University, and advisors to Plastic Oceans Australia, and others. Luke is committed to reducing health inequalities and amplifying the voice of lived experience in health-related policy and practices. He delivers health and sustainably related behaviour change programs, training and advice to domestic and global environments, NGOs, aid agencies, funders and charities. I'd like to welcome both of you to join the SMARS today. Thank you.
All right, hello everybody. So yeah, that's a fairly lengthy bio on my part. So I'm actually here in my capacity as a technical advisor to Plastic Oceans Australasia. So Ricki's actually going to be running the vast majority of the presentation, but because I'm based here in Perth, we thought it would be a good idea just to roll me out and just give a little bit of an introduction, and so I can answer questions maybe after the session. So just a few statistics to start with. And some of these you may be very much familiar with. But first of all, every year we have 12 million tonnes of plastic making their way into the world's waterways. So that's every year, 12 million tonnes. Every minute we've got 1 million plastic bottles purchased worldwide. So I actually, just before I stood up, tried to calculate how many plastic bottles that would be over the next 48 hours. And not being a mathematician, I ended up with 2,888 E9 on my iPhone. So I'm just working on this. That's an awful lot of plastic bottles while we sat here over the next few days. And every day, the average adult consumes between 126 and around about 150 plastic particles. So that's stuff that we're all ingesting, each and every one of us, every single day. So plastics, microplastics, nanoplastics are a real major issue, both in terms of human health, but also obviously in terms of the healthcare system. By 2050, there'll be more plastic in the oceans than there are fish by weight. So that's just in 25 years from now. Just a very quick word on Plastic Oceans Australasia. As I've said, I sort of volunteer some time there. It's not my day job, but I'm on the technical advisory panel. And I'm there really with the behaviour change hat, but we've got a lot of hard science that informs practice at Plastic Oceans. So all of the programs that Plastic Oceans undertake are very much science-led. So we've got environmental scientists, environmental engineers, marine biologists, and we're all very much working to try and combat plastic waste. We do operate across 12 of the 17 Sustainable Development Goals. Life underwater is obviously first and foremost amongst those. And we are today going to be talking about a pilot project that was run at King Edward Memorial and Austin Health, which was through the EPIC program. So I think at that point, I might just hand over to Ricki, who's actually going to run through the program and the program outcomes.
Hello, and it's wonderful to be here. Thank you, Luke, for the introduction and setting the stage. So Plastic Oceans Australasia, you probably wouldn't identify the name to do with health, but as it has been demonstrated by a number of the people that have been talking previously, there is a direct link between plastic waste and our health, not just in what ends up in the oceans and landfill, but also what's happening to us as people. So the thing that we really want to talk about and demonstrate with this case study that we're going to be talking to you about is that connectedness. So with the funding, and it was mentioned just before, also Mindaru was assisting the previous case study, the Bluey one, which I thought was really interesting and very appropriate to segue us into. They also helped us fund this EPIC pilot program, which is actually with 2 hospitals. We partnered with Kaha, who have been absolutely amazing, and we've worked together now for a couple of years on this project. So Carol, Beeke and myself spearheaded this with Mindaru. We got the funding and we were able to do this pilot project, which has taken us 18 months to complete. And I'll explain as quickly as I can about the project Austin Health Victoria, so we wanted something on the East Coast. And then we've also got, obviously, in your own backyard in Perth, the King Edward Memorial Hospital. And the purpose and the objective was to enable staff to reduce single-use plastic products in their workplace. And this is specifically staff consumables, not front of house clinical. So I just want to make that really clear so people know where we're going with the conversation with this. So what I thought I'd do is, for some of you, or maybe a lot of you, you may not have heard of the EPIC program. And as Luke very kindly mentioned, we have 4 areas that we do our work, which is in education, business sustainability, science and research, and then policy advocacy. The EPIC program fits under our education program, and it's all about behaviour change that is a model to actually help people to really make a change with what they're doing over a 12-month period. So the program is split into 4 stages. It stands for Engagement in Plastic-Free Innovation for Change. When we came up with the name EPIC, it was before COVID, and it was pre when the name and the word EPIC was always being used fondly, like it is today, about I went on an epic journey, or it was an epic challenge, etc., etc. So we just came up with that acronym because it worked in really well at the time. So the 4 stages of the program, each one runs over 3 months, and each one goes through a particular series of structured processes. And the other couple of presenters before were talking about initiatives that they have put in place, and it's really wonderful to see how they've done that, initiated it on their own, and managed to just keep driving that change, which is really fantastic, because we have found by coming in as an external organisation to help health systems that are under a lot of stress, you've got a lot of other things on your radar, it can get very difficult to keep doing work in this space, especially when it's only for the staff and wasn't front of house. I'll actually do a quick overview of the 2 projects, so you can see what the project aim was and what we were, what we actually have achieved over the 18-month period. So very quickly, the aim of the 2 was to demonstrate that the program can reduce waste in a health setting, and to document and disseminate the information and the key learnings from the pilot project. We had a number of hospitals that threw their hat in the ring that wanted to be in the pilot study to educate and help healthcare service providers to be more sustainable in their workplace, to demonstrate a quantified reduction in single-use plastic, and to showcase staff behaviour changes possible in challenge workplaces. And we certainly had a lot of challenges, because you can see from the dates that it was during the COVID period. So WA was still being cocooned and mothballed, and you weren't involved with the impact at the health sector with COVID. But here in Victoria, the Austin Health were very impacted about it. So we had quite a few delays that happened between both organisations at different times. So the program runs with 2 surveys, 2 audits. We then do a whole behaviour change piece. We go in and help with looking at procurement, solution-based incentives of what we can do to help the organisation make change. And because we're independent, transparent, come in and do independent calculations, the data that we're able to provide back and the reporting has been really helpful to the organisations, and also to what will be delivered to everybody globally now to have a look at the end of this session. We are going to be putting it up online, which I'll talk about in a moment. So we had our own plastic-free ranking, which was like a traffic light, as you can see, red, yellow, green, and we showed the basic score of what the organisation started with and at the beginning, and then what they ended up with. So if we go to the next slide, so you can see we've got 3.63 and 3.62, and the final score was 3.78 for Austin and 4.00 for King Eddie. Now that is pretty fantastic, because it actually meant that King Edward Hospital, the survey was to see what was going on in people's minds. What were they actually thinking? Were they really thinking about trying to make behaviour change happen? And were they able to think about how they could be plastic independent? And they got into the green line, which is really fantastic, because not a lot of organisations do. And Austin was just slightly behind them. So that was really great. So we set the baseline with the survey. I'll show you now about the audits. Followed quickly after we do the audit, we do the survey, we'll do an audit. And the audit, again, as I said before, is done twice. So the audits are really interesting because the purpose of them is to actually see whether people are actually doing what they think in their brain with their hands. And as we know, people were very stressed. There was a lot of things going on. The last thing that staff wanted to worry about was whether they had a coffee cup that had a plastic lid on it, whether they were rushing out onto the ward to try and help save a life. So, obviously there was a big balancing act for us to try and get it right and not bother people too much about what they were doing, but trying to help make that change and make it easy. So you can see with Austin, when we started, so the results of the audit were very interesting because we were able to actually show that there was a decrease of 46% in the pieces of single-use plastic from the workplace, and that was a drop. And then also there was a decrease, 73% in non-medical single-use plastic. So that was phenomenal and amazing given the incredible challenges that the organisation had. Now, you're probably looking at this screen where it's showing that the calculations for King Edward Hospital shows 77% increase in the pieces of plastic and a 5% increase with the non-medical. Now, I do need to just let you know the reason for this. There was two very pivotal reasons that this happened. Unfortunately, when we did the second audit, the bins on that day were filled by products that were not supposed to be put in there. So they had like a return on a huge number of catheters. And where did they go? They got put in the bin. They also had a whole clear out that they were doing in one of their storage rooms of tags and plastic packaging, syringes, all sorts of things that for whatever reason, they were put in the bins. So this totally skewed the results of what would have been showing what was on the left-hand side, like Austin, a decrease. So the important thing about this is to show that everything is, it was an experiment. It's it was a practice run, a showcase, a pilot, but something can always happen to throw things off the keel when things like that happen. The ultimate thing about this is that we really have learned from the challenges, and we can see what the achievements have been because of the challenges. So there was one of the main, that I've just put the top three things that were a bit of a challenge, were that at the time when we were getting going, and then as COVID hit and many other things came into the space, a lot of staff were away. There was a low support and engagement from staff during that period because it went for a long time. There also was a bit of a low executive support, even though there was a good, uptake in the beginning, things waned. So that was a little bit of a challenge to keep them interested. And challenging the workplace, as we've talked about, I've talked about already about COVID. So that was a no-brainer with the challenges there. But the achievements that were taken, the steps that were taken still to reduce the plastics in the workplace were amazing, given the challenges. We were able to identify the gaps and put forward opportunities in the workplace, working with the staff and what they had gleaned to help them move that much faster with all of our resources and what we've got behind the scenes for them to use. And lastly, really importantly, and it's been demonstrated already, there's some amazing heroes already. I can see from the number of people I've been listening to this morning that are leaders that are really trying really hard to make change off their own bat and over and above their normal job duty. So the case studies and what we're going to be providing from this, and that was the whole purpose of why Kaha and ourselves came up with this plan strategy, was that the results of what we do from this will able to help others fast track what they would like to do in their own workplace. Following on with achievements, one of the wonderful initiatives, and it was mentioned just before about coffee cups, and coffee cups are always the bane of existence for a lot of people, particularly staff in any industry, not just in the health sector. But Austin Hospital did a really, really fabulous reusable coffee cup in-house initiative, which was really fantastic. And they it really helped working with the cafe in the hospital, which was independently run, and having to get the cafe contractors to actually come on board and join the journey. So we talked to the suppliers, they got them on board, and were able to get them to help with that. So the communication was very important. So there was a whole series of communication that came out for that, and it was very, very successful. Also, speaking of communication, and again, it was being mentioned just before, the other education campaign that they've been working on and continue to work on is about glove use and about reducing glove use. And that is something that is really important to do, because as was said just before, the endless amount of use of plastic products, whether it be gowns, masks, gloves, blueies, all those things that are used 1,000 times a day, sometimes they don't need to be used. So getting people to really think about that is very important. So that was those two initiatives were fantastic with the Austin. Again, coffee was quite popular. Nominate a Mate, King Edward Hospital, they did a campaign in partnership with the Climate and Sustainability team, and they were overrun with people that wanted to nominate a mate to go zero, and they would get a reusable coffee cup from actually showing that they were trying to make a difference and go zero with what they were doing. So the first day that they did it, their actual website where people could register crashed, because so many of the staff wanted to get on to win a cup. So there you go. That obviously was working in people's brains about that modelling of how do you make those small changes. And then the next slide shows the wonderful resources that are going to be available for you now. As I mentioned, we've been holding off to release this all, and it talks about obviously the opportunities for the health sector and for other hospitals and what you can take away from this. And the last point, we'd really love it that Australia leads by example globally to showcase waste mitigation and the link to climate change. That's us. There's contact details. Thank you so much. And I hope you find this really useful. We have learned lots from it, and we hope you can use our materials to make better change faster and hasten what's happening. Thank you.